Have you ever had that experience where you look at someone you love, maybe an older parent, a grandparent, and for a moment, they seem like a total stranger? One minute they're perfectly fine, and the next they're confused or agitated or just frighteningly distant. That sudden, scary change has a name. It's called delirium. And if you've been through it, you know this quote hits the nail on the head. For the person who's in that state and for the family watching, it is absolutely terrifying. It feels like a crisis, like something you have to solve right now. I mean, that's the question, right? It's a question that can just throw an entire family into chaos. You're left asking, what on earth is happening? Is this going to last forever? What are we supposed to do? So to get some answers, we've got to start right at the beginning of this journey. You know, it rarely starts with a big, dramatic bang. Instead, think of it more like a thick fog that starts rolling in. It's slow at first, kind of hazy, and it just starts to obscure the person you know and love. The first signs are often so small you could easily brush them off. But here's the thing that's so tricky about it. These signs can come and go like crazy. One minute, your loved one might be completely unable to follow a simple conversation. An hour later, they might seem perfectly clear again. Maybe they're up all night, restless, but then they're dozing all day. This constant change, this fluctuation, is a huge flashing red sign for delirium, and it's exactly what makes it so confusing for everybody. So what exactly is this confusing, disorienting state? It's not just being confused. It's a very specific and, frankly, urgent medical condition. And to deal with it, you have to be able to call it by its proper name and really understand what that name means. And right here, this is the most critical point. Delirium is not a mental illness. It's a symptom. It's a sign that something is physically wrong somewhere else in the body. I like to think of it like the brain's circuit board is short-circuiting because there's a problem somewhere else, like in the engine. And notice the onset. It's fast. It happens over hours or days, not months or years. Okay, this slide is so important because these three conditions get mixed up all the time. Just look at the onset. Delirium is sudden, dementia is a slow, gradual decline. Now look at the course. Delirium is all over the place, changing hour by hour, while dementia is usually much more stable from one day to the next. But the biggest giveaway, the real smoking gun for delirium, it's that highly impaired attention, that inability to focus. That's the key difference. Now, delirium doesn't just show up in one way. There's the hyperactive kind. That's the one we probably all picture. The person is agitated, restless, maybe calling out, pulling at their IV lines. It's really obvious something is wrong because, well, it's disruptive and it gets attention fast. But then there's the other side of the coin, the hypoactive or quiet delirium. This is when the person just shuts down. They're withdrawn, they seem apathetic, they're sleepy. They often get labeled as easy patients, and that's why this form is so often missed, or just mistaken for depression. And that silence is incredibly dangerous, because it means the real underlying medical issue isn't getting treated. Okay, so once delirium is on the table, the mission changes completely. Now it's time for some urgent detective work. The number one question becomes, why is this happening? What's the physical trigger that we need to find and fix? This is just a great way to think about it. The brain itself isn't broken. It's just being completely overwhelmed by an outside force, maybe an infection, a new medication, or dehydration. The job is to find that force and shut it down. And get this, it's almost never just one thing. There was this one study that found, on average, there were 8 different contributing risk factors in a single patient. 8. It's such a powerful reminder of how a whole pileup of what seem like small issues can suddenly push a vulnerable brain right over the edge. So what are these detectives looking for? Well, this slide basically lists the usual suspects. Things like infections, a urinary tract infection, or pneumonia are super common culprits. But honestly, it can also be something that sounds simple, like being dehydrated, or starting a new medication, or even just being severely constipated. The good news, so many of these things are fixable once you find them. So while the medical team is hunting for the cause, what can you, the family, and caregivers do? This is where you become a huge part of the treatment team. Your job is to help anchor your loved one back to reality. I just love this quote. In the middle of that terrifying, confusing storm that's happening inside their head, a familiar face, a calm voice, that's their lifeline. You are literally their connection to the real world, and just being there is incredibly therapeutic. But how you communicate really matters. This is not the time for long, complicated talks. Keep it simple. "Hi, Dad, it's me, Sarah, you're safe in the hospital." And if they're seeing something that isn't there, arguing with them is totally pointless. It just makes things worse. Instead, you gently correct with your reality. "I know you're seeing that, and it must be scary, but I don't see anyone in the corner." Your calm presence is the most powerful tool you have. And you can help reorient them just by changing the environment. Little things like making sure they have their glasses on and their hearing aids in can make a world of difference. A clock, a calendar, a few family photos, these are all anchors to reality. Keeping the room bright during the day and dim at night helps reset that scrambled internal clock. So let's be crystal clear on this. The main treatment for delirium is to treat the underlying cause. Medications like antipsychotics are not a cure. They are only a last resort, used for short periods when someone is so distressed that they're a danger to themselves or the people around them. All right, so the infection is treated, the confusion starts to clear up, and the fog finally lifts. Everything goes back to normal, right? Well, not always. The recovery period is every bit as important as the crisis itself. And this is such a vital question. I think for a lot of families, the second the person seems like themselves again, there's this huge sigh of relief and a feeling that the whole thing is over. But that experience can leave a really lasting mark on both the patient and the family. And the data really backs this up. I mean, look at these numbers. They're pretty stark. Almost half of older patients still show some signs of delirium when they leave the hospital. And for more than a quarter of them, those symptoms are still there 3 months later. Recovery can be a really slow road. This is exactly why aftercare is so critical. You need to talk about what happened. Some people will have no memory of it at all, but others have these vivid, terrifying memories of their delusions. Helping them process that is key. And maybe most importantly, once someone has had delirium, they're at a much higher risk for it to happen again. Learning to spot those early warning signs can make all the difference in the world next time. You know, at the end of the day, delirium is a medical emergency that often hides in plain sight. It gets disguised as just getting old or dementia or difficult behavior. But by understanding what it is, what causes it, and how we can respond to it, we can literally pull our loved ones out of that fog and back to safety. And that leaves us with a final thought. Now that we know the signs, what are we going to do to make sure we're watching for them?